So lumbar fusion is a procedure that we do fairly frequently. Usually that's going to be for an arthritic condition, or maybe you have a problem with the alignment, which is called spondylolisthesis. It's a big word, but it just really means offset in these vertebrae. And sometimes that offset starts pressing on these nerves or pressing on the spinal cord. Lumbar fusion is where they go in the back. Usually, sometimes they do go in the front, but I'm going to talk about the posterior fusion, which is going in the back part. So the surgeon would go in and remove the arthritis, maybe even remove this whole lamina or some of the joint, and then they're going to put screws into the vertebrae and connect that with a rod. So that is a surgery, depending on how many levels you have to do, is going to depend on how long the surgery is, but I would say at least probably 2.5 hours. There's going to be a lot of muscle that's cut just to get there, and then to move the muscle out of the way. So those patients tend to have to stay in the hospital after surgery at least usually 2 to 4 nights. Every once in a while somebody can go home after one night, but that's pretty rare. And the reason for that is it's painful. You're probably going to need some IV pain medicine, not just oral pain medicine. You're probably going to need some IV fluids just because the surgery is so long and you're not going to be able to drink, while you're in surgery. We like you to work with a physical therapist the next day before you go home. So all of those things, when we put all that together, we do usually have to keep these patients in the hospital. When you are in the hospital, you're going to be getting a lot of education from our medical staff. Kelly, our hospital-based PA, does a really good job getting you prepared to go home, plus Dr. Walpert and Dr. Patil. You might even see one of the other mid-level providers, but we can troubleshoot what you're going to be looking at when you go home. The physical therapist at the hospital is going to be seeing if you need home physical therapy, or you might even need rehab. You might not, depending on how debilitated you were or what your other medical conditions are, you might need to go for a short stay at rehab. But we're going to be walking you through that and figuring out the best place for you to go home. And some people don't have to have physical therapy. But yeah, I would expect that you would be in the hospital for 2 to 4 nights. You might have a drain, that's just going to be underneath the skin. And that is going to drain out any extra fluid that they use to wash out the area. Plus, you might have some bleeding. Usually that stays in 2 days or so. Some people, if they're comfortable with it and they need the drain for longer, we have been starting to send some people home with the drain, and then you just come back to the office to get that out.